Hi everyone, Susan Vileta here, and this week I have Dr. Erin Hayward with UIHC with me for Vaccine Watch Wednesday. Thanks for being here.
I am thrilled to be here. Thanks for having me.
Great. So we want to ask, why did you get the vaccine and how did it go for you personally?
I was so excited to get my COVID vaccine. I practice family medicine at the Scott Boulevard Clinic. That's where I have my outpatient clinic, and I see babies to old people there. And I also practice inpatient medicine in the United and in at UIHC in the hospital. So those of us who were doing inpatient medicine in the November-December time, we're seeing a lot of COVID patients during that time. We had it. We had the advantage, I guess, of being the first ones in line to receive the vaccine, which was an honor and a privilege. And honestly, when I showed up to get my vaccine at the Employee Health Center, it was the best party I'd been to in a year. The mood was high, and folks were really happy to be there, having a good time getting shots in the arm. So it was a very well run process. This was back in December. I think it was December 21st, right before Christmas. Got my shot in the arm from an EMT student. I was his second ever vaccine recipient, and had a very sore arm for the next couple of days. I had a similar experience the second time around. The second time I had more fatigue. That's pretty much standard. Yeah. The sore arm is definitely standard. The fatigue I hear a lot of. I had it equally, I guess, after both the first and second doses. But I was out for a run the next morning, and I ran into a colleague who had been just ahead of me in line, and he'd spent the night with fever and chills that lasted for 2 hours. And then the next morning he was happy to be out exercising again that next morning. So it really was pretty transient for him. Yeah. That's a pretty common set of scenarios, as well as the fever, the chills that are transient. They really do get better. And so we would be lying if we told our patients that the side effects are that the vaccine is without side effects. This vaccine has side effects. They are expected. It's what the immune system does, is to get us riled up and ready for COVID when we would be exposed in real life. Yeah, we would be lying if we said there are no side effects. There are definitely side effects. The reason that I got the vaccine, I'll be honest about my demographic. I'm a very healthy woman in my 30s. I am not likely to die of COVID-19. Of course, people in my demographic do die of COVID-19. It's unpredictable. But for me, my fear was not of death. Honestly, it was of some of the longer term impairments that I've seen in my patients. Since this summer, I have seen my patients who have suffered with COVID-19 get over the initial illness, but even those who had a relatively mild case have had really prolonged symptoms. Many of my patients have had incomprehensible levels of fatigue, unexpected. People who are normally extremely functional people who've had no health concerns prior to this. I have a woman who was unable to get out of bed for weeks and weeks, and to this day she still actually needs to be in a wheelchair if she's going to go more than 50 to 100 feet. And this is someone whose history I do not doubt. I have patients who have new asthma-like symptoms that they've never had before. Just a lot of difficulty with just basic function, some brain fog, all of these things that we've heard about. Those are real. They are not counted in our statistics of death numbers, but this is a really serious illness that impacts people's lives in so many ways. So that's what I was worried about for myself, quite frankly. That's why I was very happy to get this vaccine when I had the opportunity to.
And when urging your own patients or just the general community here that we're talking to now, what would you tell them?
I would say that the vaccine has been tested on. It was tested on. I got the Pfizer vaccine. There are 40,000 people in that trial, including friends and colleagues of mine here at the University of Iowa, and they did well. There were no serious the serious complications from the vaccine are incredibly rare. And the first people that it was tested on were doctors, nurses, people that really understand the biology of the new vaccine methodology. It's beautiful and elegant in the way that it works, and it's one of those things when you understand it, it's like why didn't I think of that? Obviously we've been working on it I say we, the scientific community has been working on that technology and the understanding of the biology of the novel mRNA vaccine technology for a while now. But
well, I think that scares people, right? Oh, it's something new.
Yeah.
But then when we know that health experts have been working on it, with SARS, right, and other coronaviruses, I guess, for a long time.
Yeah, I mean, this is like freshman college biology level understanding. I understand how it works because I had to take my pre-med classes, and it does make a lot of sense the way that it works and the way that it's explained to us. And as more and more people get the vaccine, we're not seeing bad effects from this. We're seeing that people have those side effects that we anticipate, but it is a safe vaccine. It was developed quickly, but it was developed quickly because people have been preparing to develop a COVID or to develop a coronavirus vaccine for over a decade. And a lot of great science has gone into this for a long time. So the fact that this vaccine was developed quickly is just a result of everything that's been going on in the background, and with everyone in the infectious disease community, the immunology community, the biology community in general, and the vaccine scientists all working together on the exact same goal, and having an unlimited amount of funding to do it. And when all those things align, you can get a lot done in a pretty impressive way. So I was pretty excited to be one of the early recipients here in Iowa, especially since I had already seen all my friends in the trial, and I was disappointed I couldn't sign up myself.
So then you took your shot.
I did.
When you had your shot, you took it, and that's what we're trying to tell the community. Like this is our shot, Johnson County.
Good. That is a conversation I have with many of my patients. I'm fortunate, and most of my older patients have gotten it and have had it for a while now.
Good.
That's a good feeling. And I spend a lot of time in every day of my clinic right now, just answering individual questions about the vaccine. It's okay to have questions. It's okay to have concerns, and that's what we're there for. So even though we're actually not giving the vaccine in our clinic specifically, we're routing everyone through the university. I do spend a lot of time talking about it.
Good. Well, I appreciate having you on and sharing your experience, and telling the community that when they have the opportunity, get it.
Go for it.
Thank you.
Thank you.